Good evening, this is Tanya with MSN News discussing my policy platform. Providing healthcare options to ensure every American has access to doctor's visits, hospital coverage, prescription coverage, and ancillary services like dental and vision benefits is a huge task. These services are available but at significant cost to the end user. Medicare provides these services to Americans over the age of 65 who have paid into the system over their lifetime, or individuals who've been deemed disabled. Medicaid provides similar services to indigent individuals, pregnant women, and children. And of course, private insurance offers coverages to those who pay high premiums to have access. But what about those Americans who don't meet any of those categories? Perhaps young people who've fallen ill, or folks who've lost their job because of a downturn in their economy in the area in which they live, and the insurance coverage left with the job. Or maybe elders who've never paid into the system, and now they have nothing to get back from. Well, how does the richest nation in the world continue to rank 37 out of 191 healthcare providers in the world, according to the World Health Organization? Well, a public option may be a viable solution to some of these issues. Medicare X Choice Act of 2017 is a bill to establish a public health plan that will create a low-cost public option for healthcare available in every zip code. Americans could choose between the existing private insurance plans or a public option. Medicare X would build on the Medicare framework of doctors to establish a public insurance plan offered to the individual and small business health exchange. This plan would be available initially in areas where there's a shortage of insurers or higher healthcare costs due to less competition, and then expand to every zip code in the country. The plan would pay health providers at negotiated rates, not substantially lower than Medicare rates orchestrated by the federal government. The creation of this new government-run plan for those under the age of 65 would compete against private insurers in the individual market exchanges. This public health plan would intentionally fill the gap in areas where insurance options are limited, offering consumers choice and competitive pricing. The point is to ensure that all Americans in the individual market have access to affordable health care. Even if private insurers raise rates or exit the market, the public plan would offer the same coverage and benefits nationwide, with prices variant depending on their region. The theory behind the public option is it will lower the cost of health insurance by introducing competitive pressure on insurers and allowing more people to purchase coverage. If this type of public option were open to everyone, healthcare experts at the Lewin Group, a subsidiary of the United Health Group, estimated that it would attract 20.6 million people, 12.5 million of them moving off of private insurance. While public plans don't have to worry about turning a profit like private plans do. Add all of this together, and the Congressional Business Office has estimated that premiums for the public plan option would be 7 to 8% less expensive than private plans offered in the marketplace. Now, this could be a conservative estimate. According to Kaplan and Rogers, conservative cost savings by implementing a public option can range anywhere from $500 to $700 billion over a 10-year period. That's a significant amount of change. Again, the public option should be made available to as broad a segment of the population as possible. The proposal is to make the option available to the unemployed and small firm or self-employed workers who lack workplace coverage. Even in a restricted market, a public option would exert some competitive pressure on private insurers for this new pool of customers. But a more restricted market for the public option will put less pressure on private insurance companies, private insurance plans to lower prices than a universally available public option would. So cost is always important. The public option could pay providers at Medicare rates or Medicare Plus rates. Medicare provider rates are much lower than private insurance rates. Low premiums will make the public option popular with consumers, which obviously is important. They can afford to have coverage now. But low reimbursement rates coupled with lower administrative costs are going to result in lower premiums, which is going to make this an unpopular choice with providers like doctors and hospitals. Only if patient volume is high enough will providers have an incentive to contract with the public option. Therefore, consumers will only be interested in a public option if it's able to attract and retain adequate provider network. Now that's important because, we want to make sure that our customers, our consumers, our tax paying dollars are going toward good quality providers and not, scraping the bottom of the barrel. So there has to be a balance between cost control with the appropriate provider reimbursement in order for this process to even be viable. Well, how are we going to fund this? According to the World Health Organization, the Health Report 2010, quote, financing systems need to be specifically designed to provide all people with access to needed health services, including prevention, promotion, treatment, and rehabilitation of sufficient quality to be effective, and to ensure that the use of these services does not expose the user to financial hardship, end quote. Therefore, funding could be provided at the federal level and the state level. Each state could raise funds for health or diversify their funding sources if they decided to. Options would include governments giving high priority to health in their budget allocations. So everybody gets a little money from the government. And so what we would petition for is for that budgetary allocation to be higher for healthcare than maybe for, transportation costs. So shifting monies from one bucket to another, if you will. Collecting taxes more efficiently, and then using those tax dollars, again, to fund healthcare, including compulsory insurance contributions. Also, raising additional funds through various types of innovative funding mechanisms. One such mechanism could be increasing taxes on harmful products such as tobacco and alcohol. Now, these increased taxes will drive reduced consumption. People don't want to pay $7 or $8 for a pack of cigarettes, or $9 or $10 for a pack of cigarettes. So we assume that if the higher the cost of those things, the less people will want to utilize them. As such, their health will be improved, increasing resources that governments can spend on healthcare. Clearly, providing adequate healthcare is possible. What's required, however, is innovation, commitment, clear objectives, and collaboration of minds to ensure that our citizens are properly cared for at an affordable price.